response activities across member states. As well, we will also be bringing you various highlights from across the continent and the Africa CDC engagement with member states and partners, especially now in relation to the new SARS-CoV-2 variant with multiple spike protein mutations that have been reported in South Africa, in the United Kingdom, and in other parts of Europe. Then after that, we will go into our question and answer session. And just to remind you that, as usual, you can follow our briefing in 3 official languages of the African Union. And today we have English, French, and Portuguese. Please do feel free to access your preferred language on this platform. But you can also follow us live on the African Union and Africa CDC's digital platforms. And those would be Facebook and YouTube. Please note that the Africa CDC Facebook page is also providing French interpretation. Now, for your question and answer sessions, please use the usual WhatsApp number, and that number is +251 945 502 310. Let me come back again with it. +251 945 502 310. Please be sure to include your name and the institution that you represent. This is very important because this is a briefing for the media. So we would want you to please put both your name and your media institution. Alternatively, raise your hand or use the question and answer section. Now, today we are joined, as usual, by our host, Dr. John Nkengasong. And Dr. John is the director of the Africa Centers for Disease Control and Prevention, abbreviated Africa CDC. I will hand over to Dr. John now for his briefing before we go into the Q&A session. Dr. John, you have the floor.
Thank you, Wayne, and good morning to everybody. It's always a pleasure to have the opportunity to discuss with you all on every Thursday at 11 a.m. East African time. I would like to wish everybody a happy holiday season. Today is the 24th of December, and it has been a long year, to say the least. And we are very happy that some of us, all of us, will be taking some time off to celebrate the end of year festivities with their families. But while we do that, we need to do that safely. And remember that a large gathering inside the home provides an opportunity for transmission of the virus. We want to protect ourselves, but also protect our families as much as possible. The Africa CDC has actually issued guidance just 2 days ago on how to celebrate this end of year's festivities safely. We really strongly encourage that those guidance are shared across multiple outlets so that people actually know exactly what to do when we are celebrating. Again, this is not a Christmas holiday or end of year festivity like others. We have to actually strike a balance between celebrating safely and protecting ourselves and our loved ones, and know that the pandemic is here. We will be celebrating, but the virus is not celebrating. They will be looking for an opportunity actually to infect people and get transmitted. So it is my strong appeal to each and everyone that as we go away today and to right up to New Year, to take those measures at heart and know that the virus is just at the corner waiting to have an opportunity to transmit. So let me now transition to the regular epidemiological update, whereas as of 9 a.m. East African time today, over 76 million cases of COVID-19 have been reported across the world, with about 1.7 million deaths also reported globally. In Africa, we have reported accumulated number of cases of 2.5 million cases, and this accounts for 3.3% of the total cases globally. Of that number, that is the 2.5 million, 2.1 million people have recovered, and this accounts for 84% of total cases reported on the continent who have recovered. Sadly, 60,000 people have unfortunately died, resulting in a case fatality ratio of 2.4% and representing an overall 3.6% death when you factor that into the global pandemic and deaths. The 5 countries that are accounting for close to 70% of the caseload across the continent include South Africa with about 950,000 cases, that is 37%. Morocco, 423,000 cases, that is 16%. Egypt, 127,000, 5%. Tunisia, 125,000, 5%, and Ethiopia, 120,000, or 5%. When we look at the trends over the last couple of weeks, and I'll look at, first of all, just this last week, from last Thursday when we met to today, what has been the changes. Then after that, we look at the 4 weeks interval. So first of all, what has happened between last week and today, last Thursday and today? A total of 129 new cases of COVID infections have been reported, and a total of 3,000 new deaths have been reported across the continent. And this represents 10.9% increase in number of new cases, and also an increase of 26% in deaths. So our infection rates are increasing, our death rates are also increasing. 5 African countries that are reporting the highest number of new cases are South Africa with 60,000 new cases, Morocco 17,000, Tunisia 9,000, Nigeria 5,000, and Egypt 3,000. 5 countries with the highest daily incident per million. If you take that number now and you normalize them by the million, what are we seeing? We still see South Africa, Tunisia, Namibia, Libya, Morocco, and Eswatini. When we now look at the last 4 weeks and we see what has changed over the last 4 weeks, we see the following trend: an overall increase of 8.6% over the last 4 weeks. And the breakdown by region include 9% increase in Central Africa, 4% decrease in East Africa, 7% decrease in Northern Africa, but 36% increase in Southern Africa and 29% increase in Western Africa. So the trends that we are seeing are really pushed and fueled by the panic panning out in West Africa and Southern Africa. If we now take the 4 last weeks and you say, what is the situation with our most populous countries? Nigeria has reported over the last 4 weeks an average increase of 52%. Ethiopia, a decrease of 2%, so a consistent decrease. Egypt, an increase of 15%. DR Congo, an increase of 29%. South Africa, an increase of 40%, and Kenya, a 22% average decrease. So Kenya and Ethiopia, we are seeing consistent decreases, which is good news. And that's why the number of East Africa represents the region with the 4% decrease overall because of what is happening in Ethiopia and Kenya. Because of that, if you take again the same 5 countries to the most the populous countries there, then we see Nigeria with 63% increase in number of deaths, Ethiopia 10% decrease, Egypt 19% increase, DRC with about 42% increase, and South Africa 23% increase. Kenya is recording a 16% decrease. So decrease in Kenya are recorded both in new cases and deaths as well. If we now look at the overall testing number across the continent, we notice that we've conducted, or the continent has reported an accumulated number of tests that have been done to above 25 million. And this includes a 3% increase over the past week. 10 countries are contributing over 70% of the testing. That will be South Africa, Morocco, Ethiopia, Kenya, Egypt, Nigeria, Uganda, Rwanda, Cameroon, and Ghana. We just received some test donations from the United States government that will enable us to support and expand our testing footprints in Comoros, Sao Tome and Principe, the Kingdom of Lesotho and Eswatini. We are very grateful to the United States government for this timely and important donation. Over the last week, we've deployed 241 community health workers in Nigeria. That brings us to a total of about 12,682 community healthcare workers that have been deployed since this pandemic started in over 20 countries across the continent to support national response. And so these 12,600 community workers are those really directly deployed by the Africa CDC. An additional 3,000 community healthcare workers will be deployed to support member countries that have requested this support. And it's also important to note that over the last week, we've trained over 471 candidates from across 13 member states on the new antigen test, so that they are armed and ready to deploy the test across member states as we expand that testing device. So let me now segue to the new variant. We all know that there's a new variant, the SARS-CoV-2, the virus that causes COVID-19, was reported in South Africa. Actually, last Friday, the government of South Africa had a press briefing and briefed the whole world on this occurrence of this new variant. And we also know that this variant, a similar variant, different lineages, but very similar mutations have been reported in the United Kingdom and other countries. The new variant is defined by multiple non-synonymous mutations in the spike protein. And 3 of these mutations are located on the receptor binding domain of the spike protein. The most notable being the 501, what is commonly called the N501Y mutation on the receptor binding domain. And this is directly binds to the human AEC receptor, which is the receptor that allows the virus to bind to the cells. In response to this, the Africa Centers for Disease Control and Prevention on the 21st of December convened an emergency task force meeting, what we all call the African Task Force on Coronavirus Response, AFCOR, which included colleagues from South Africa as well as those from the United Kingdom to share experiences on and new findings on the virus. The Africa CDC, through the Institute for Pathogen Genomics, is coordinating actions to further investigate the new variant to determine if it is more infectious, more transmissible, or has the potential to cause more severe illnesses. Research is being conducted to assess the impact of the mutation on the performance of existing diagnostic tests, serologic assays, therapeutics, and vaccines. We encourage all member states to enhance implementation on ongoing public health and social measures to prevent further transmission of COVID-19 as a whole, including correct and consistent wearing of masks, physical distancing, hand washing. We also recommended from the emergency task force that there was absolutely no need to restrict travel because at any rate, across the continent, a negative COVID test is required to travel. So, I mean, what we should focus on is really the measures that are in place to prevent transmission of COVID, not a specific variant, because the same measures that I just listed will prevent COVID transmission, plus the requirements of a negative test to travel across the continent. It gives us confidence that there should really be no restriction in travel or trade. Let me just conclude by saying that we also are very pleased to announce that the European and Developing Countries Clinical Trials Platform Partnership, EDCTP, and Africa CDC are partnering with a network of 51 institutions on the continent and Europe to train over 120 African epidemiologists in response to the shortage that we have on the continent. The training will produce a cohort of highly skilled epidemiologists, biostatisticians that will boost the capacities of ministries of health in order to conduct surveillance and respond to disease outbreaks. Wayne, thank you for the opportunity, and over to you.
Thank you very much, John. Now, colleagues, we've come to that question and answer session, and already we have a question that has come in from Joao Forster of the German Press Agency. Now, Joao says, how dangerous is the new coronavirus variant that has been discovered in South Africa? And goes on to say, has this variant spread to other parts of Africa? And finally, has the variant discovered in the United Kingdom also been found in Africa?
So very good questions. I think let me first of all say that we should expect that these new variants will continue to emerge for several reasons. This virus is what we call the RNA virus, which these are viruses that are not stable. They tend to replicate and create errors. For their own survival, they have to survive. If they have to, so they keep changing. But the rate of change of these viruses is nothing compared to the influenza virus. So relatively speaking, it is a very stable virus. Now, in terms of how dangerous this virus is, this is what we know about the virus so far. It transmits quickly. That is why it's actually responsible for a vast majority of the second wave in South Africa. The viral loads are higher. That is, the burden of virus in an infected individual is higher amongst people that are infected with this variant. And we still don't know if it correlates with severe disease or not. Higher viral loads doesn't necessarily mean that it translates to severe disease, but it's a correlate that it could potentially lead to severe disease. So that's what we know about the virus. What we don't know about the virus is whether it has an effect on diagnostics, and we don't believe so, because if it had an effect on diagnostics, it wouldn't have been picked up in the first place. So that is one. Second is whether it would have an effect on vaccine development and efficacy. And because the vaccine are developed using the entire protein, spike proteins, and this is just a mutation, we have to look at the conformational structure of the protein, the overall protein, and not just those specific mutations. However, it is worthwhile insisting that research would guide us in future as to what this means, because there are several mutations there. Thirdly, this virus strain is different from the one in the UK. It's called the lineages. The lineages are different, the mutations are similar. And have we seen it across other countries? We are now beginning to hear reports that this same lineage, the South African lineage, is being picked up in the UK. And we also know that similar lineages have been reported in Nigeria, just this week by Professor Christian Happy's group. So I think it's something that is evolving. We'll continue to track. We don't know the extent of spread across the continent, but as I indicated, one thing you should be absolutely sure is that the Africa CDC Pathogen Genomic Institute, which was launched last year, and a few weeks ago, we actually had a big launch of a pathogen genomic program. We'll go into full swing using the centers of excellences to begin to characterize this virus and understand the epidemiology. So I think that is those were the answers to your questions.
Thank you very much for that. Now, as a follow-up to that, we have this question. The first time that the continent was struck by the coronavirus, we had limitations in terms of travel. Now, should we restrict travel into and out of Africa due to this reported new variant?
No, my answer is no. We should continue to focus on fighting COVID-19 virus and applying those public health measures that are known, that include avoiding gatherings, social distancing, wearing of masks, hand hygiene. If we do those measures, then we prevent the overall transmission of COVID-19. Remember, this is a variant of the virus, not a new virus, an entirely new virus that requires new methods of prevention. So with respect to travel across the continent, as you all know, if you've traveled across the continent of Africa, you are tested multiple times. And you tested on departure, you tested on arrival, and at times multiple testing there. So with that kind of testing going on, there is no specific need to recommend that we restrict travel. Now, with respect to the second wave, measures will be in place that are responding to the rising pandemic in the second wave and not necessarily to the variant. I think that is very important. If we tackle the COVID-19 transmission, then we tackle the variant, because the variant is just a subset of the.
We have an observation from Stan Moncho. Stan is in Nairobi. He doesn't tell us his agency, but he has been on this show before. And Stan says, "Good morning, team. I just want to register that as I was traveling to Nairobi last night, I noticed that probably to the unintentional spread of the virus is the behavior of people during the sustenance services." And by sustenance, I think it means meals. And he says it is during this time that masks are let down for some hours. And he doesn't ask a question, but perhaps he wants to hear your response to that, and if there is any advice that you can give in terms of people who are on an aeroplane and also have to eat at the same time. He sees this as a potential contributor to the spread of the virus.
So let me respond as following. One is that we truly don't know yet, based on statistics, if that the traveling and eating, removing masks to eat during travel facilitate transmission. For one thing, there's absolutely no flights on the continent that do not require a negative COVID test. So you really have to assume that most people that are on board are negative. Having said that, this is a virus that transmits very quickly, and you could actually have tested negative 2 days ago, and by the time you board, you pick up the virus there. But we, because of the distancing that we believe planes are exercising, airlines are exercising, that will continue to minimize that. But what you said is something that requires that we keep investigating to see if there are increased number of cases on flights across the continent. So I think, as I said, we're learning so much about this virus, continue to learn behaviors, and also balance between saving our economies and saving lives.
All right, thank you very much for that. I just want to give a reminder to all the journalists who are watching us that you can ask your questions using WhatsApp number +251 9455023110. Alternatively, you can send in your questions on our Q&A section on this platform, as well as also raise your hand if you prefer to ask your question live. Now, let's move on to a question that has come in, and it is talking about some messages that have been circulating on social media platforms, claiming that there have been a number of deaths in countries where vaccinations have been administered. And the question would then be, is this true? And should people be afraid of the vaccinations?
No, that is absolutely not true. In the affirmative, there is I can't wait to get my COVID vaccine once those vaccines begin to show up on the continent. We should always remember that vaccines and vaccinations are not new on the continent. Our own very existence, my own very existence, is because of the vaccines that I took during my childhood period, and continue to take some of them now, like the yellow fever vaccine, the cholera vaccines, those multiple vaccines that we've all taken to protect us from all these infectious diseases. So it is extremely unfortunate that there's a lot of misinformation on the media. Media meaning the social media and different forms of communications. So we really count on the main media, respectable main media like you all, to continue to counter these messages and share the right information. I've seen very outrageous videos on social media where they show that somebody who is vaccinated, immediately you fall and you develop whatever. Absolutely not true. Would there be people sick once they get vaccinated? Yes. The sickness means you develop a fever, your arm will swell, but that all means that the vaccine is working. Okay, we should understand how vaccines work. Vaccine works because you stimulate the immune system reacts. As they react now, they may raise your temperature, and that really is a good thing because it shows that your body is responding, which means that your army of white blood cells is ready to go on the offensive once they're exposed to the virus. So it shouldn't be taken being negative, because the social media will be full of this characterizing people that have received vaccines, and there's absolutely no problem with that. Or most vaccines that you receive, I have received, cause you initially a fever, but there is nothing unique in this vaccine that is making people going to fall sick and die, and because of that. That is absolutely not true. We've seen also on the media that the United States, Tony Fauci took the vaccine, I think yesterday. Incoming President-elect Biden took the vaccine. As I said, I cannot wait to take the vaccine myself once it's available on the continent.
Thank you for that. We have a question from Kara Anna, and Kara is with Associated Press. She says, thank you for the briefing. You say that similar lineages have been reported in Nigeria. Do you mean similar to the variant in South Africa or the one in the UK?
The one we are seeing in Nigeria, and this is based on very limited data yet, and it has the 501 mutation, but it looks like it's a separate lineage from both the ones in the UK and South Africa. So again, this is just based on about 2 or 3 sequences, but that suggests that we need to expand that investigation in Nigeria. I think the Nigerian PI, a principal investigator, has just released those sequences, and we'll be happy to share that with everyone. But it's a separate lineage from the UK and the South African lineage.
We have the next question coming up from Aldrin Sampia from SABC. And Aldrin says, is it clear yet whether the vaccines that are currently available would also be effective with the South African variant?
Absolutely. As I said earlier, the vaccines look at the total protein, what we call the conformational structure of the protein, and not just a specific mutation. But having said that, I think I'm always humble enough as a scientist to say that you just don't know what you don't know. And until we start doing the vaccination at scale and conducting studies to follow up and see the efficacy and understand the correlations there, we have to assume that the vaccines will be efficacious, especially because the vaccines are based on entire proteins and not just those mutations.
All right, we have a quick...
valid question, because the mutation in South Africa is closer to the binding, the receptor that accounts for the neutralizing antibodies. So if that is affected, then of course you could speculate. This is all hypothesis and nothing tested yet.
Right. We have a follow-up to that. The new variant that we are discussing, is it associated with an increase in the severity of the disease?
So the new variants that we are discussing as associated, what is absolutely clear is that they transmit quickly, and they're accounting for a large number of people that are infected. I think, which means that if you look at the dynamics in South Africa, around October, they picked that up very early on. But then if you see the recent wave in COVID-19 wave in South Africa, it is now the predominant variant, which means is outcompeting the other viruses. So I think that is for sure what we know. With respect to whether it's causing more disease, severe disease, I will underline the word severe disease, we just don't know. I mean, if people are infected, you expect that you'll be sick. And if you are sick, say with fever, cough, or whatever, it's still a disease, but it's not a severe disease. Okay, I think that is important. So we just the patient so that more data is generated from South Africa and the UK to understand exactly the correlation between these new variants and pathogenesis, that is the disease causing ability, and also the severity of the disease of this new variant.
Thank you for that. I can see that there are some colleagues who are writing their questions, but they're still to come through. And while we are waiting for them to come through, do you want to just go over? I know we spoke earlier about some of the misinformation around the vaccinations that are currently ongoing. Do you have any other examples of fake news that you feel should be debunked at this moment?
Several of them. One is that, the messenger RNA will get into your cells and transform you into something else. Is false. The messenger RNA technology is simple an expression. It only induces that genetic piece of material called the RNA to express a protein. So it's a reverse technology, new technology, which says instead of injecting a protein into an individual, or a peptide, which is what is usually used for vaccination, you inject an RNA that uses the other mechanisms outside of the nucleus to express those proteins, and then the immune system will see the proteins there. So that is really not true. The other thing is that I'm hearing is, are there chips that are embedded in these vaccines that will go into our bodies and create us harm and enable us to be censored? Absolutely not true. We should know that the history of vaccination doesn't start today. I mean, the way social media is playing this is as if vaccination is new. It's not new. We know for polio virus that you actually use attenuated live virus, which is you delete some genes in the virus and use that virus to boost the immune system, for polio. So there are all forms of ways of developing vaccines, and I think this one is not exception at all with this. But with this, the speed of why we've achieved this vaccine so quickly is because many things were done in parallel, which before had not been done. I mean, like starting a phase one trial, which is safety. You just do that on a handful of people, and then once we knew that the phase one trials were being safe, so they started almost in parallel. So that's why we caught up so much with an efficacious vaccine within 1 year. So I really would count on all of us to make sure that we spread the right information. We go to the Africa CDC website to get the right information. We go to the WHO website to get the right information, the US CDC websites, or the public health agencies of the world. That's where we should be going to getting the right information.
Cara Anna has come back. May I ask Thank you. We were having some interference there, but I think we are sorted out now. Thank you. Cara Anna has come back with a follow-up question. The new variant in Nigeria makes up what percentage of the new infections there?
I think, Cara, as I said, it's just this week because of this alert that the Nigeria CDC and the Center for Genomic Studies, headed by Professor Happy, will be analyzing more samples, and especially in light of the new wave, because you have to do this almost within the weeks and not months, so that you can pick up that. So give us some time so that we know what, once those analysis is done, we would, just this morning, we were in discussions and coordination with the Nigeria Centers for Disease Control and Professor Happy's group in an email exchange to be sure that they can move forward speedily to support Nigeria CDC to analyze those samples. So it's still very early. I'm sure that not just Nigeria, but we'll continue to expand the analysis across the continent through our pathogen genomic network. So time will tell. We'll bring you more information and new information as we find it.
Thank you for that. We have a question from Ben Chapwana. Ben doesn't say which media agency he is with, but he wants a follow-up on the distribution, the geographical distribution of the new variant in Africa. I know you mentioned earlier about 2 countries, but he says, are there any other countries that have reported this?
No, that's a very good question. Again, remember, this is just happening over the last week. The first time that the government of South Africa reported this was on last Friday. And on Monday, the Africa CDC convened the emergency meeting. And one outcome of that meeting was that the network of pathogen genomic centers that Africa CDC established last year should go into full swing to conduct large-scale surveillance activities across the continent to pick that. So that is work in progress. We will be working very speedily to continue to support countries to understand the spread of this new variant across the continent. But for now, we are just still at the conception stage.
All right, thank you very much. I think all our questions have been answered. I'm not seeing anyone coming online to ask a question. So perhaps to round off our press briefing for today, may I ask you please to just restate your messages that you want the media to be able to send out, especially now as we are going into the festive season?
I think I have 2 sets of messages. One is that concerning this new variant, we should really make sure that we inform the public accurately that this is a variant, which means that the same measures that we have been using throughout this pandemic to fight COVID-19 should apply and should work. I think that is one. The second thing is that be rest assured that the Africa CDC, through its pathogen genomic network and institutes, or centers that are established across the continent, is at work to understand the extent of the spread of this virus, but we diligently and accurately. The third thing with that is that we don't absolutely see no reason to restrict travel, because at any rate, you require a negative COVID test to travel across the continent. And the measures that we put in place to prevent the spread of COVID-19 should apply against this new variant. So no need to institute restrictions. It's a strong appeal to our member states. It will just be unnecessarily disruptive. We see what the Europeans started doing that, and it created huge problems. And I think they're revising all of that. We cannot panic. Let's allow science to drive our response and not just react to it. It will continue to be disorderly. Lastly is that we believe that this mutation will not have an effect on the vaccine's deployment, because it is just a mutation in the entire protein, the spike protein. And we will continue to find out as we conduct more research to understand the potential effect on vaccines. I think that is one. Second set of messages is that I'm wishing you all a happy end of year holiday season, starting today, 24th, which is Christmas Eve. For those who celebrate Christmas, but we should celebrate the end of year festivities with care and with safety at the heart. Know that this is an unprecedented year we are living with, and avoid large gatherings indoors. make sure that we social distance. 1 in 5 infections occur inside the house by people that are coming and visiting and going out. We should really make sure that we restrict that and really exercise that love for ourselves and love for our loved ones, because we want to deny the virus any space of transmission. Let's actively work and deny this virus the ability to transmit by also modifying our behaviors. If we do this, then we are sure that come January or February, we'll not see a big spike in infections. But if we do not do this, then we'll see a spike in number of cases in January and February across the continent, and that will continue to damage our economies and continue to pose a serious harm to our own lives and livelihoods across the continent. I think I'll end by saying that it is all our individual responsibility and self-accountability to make sure that we exercise these measures which we have put online. Anyone can go online and pull and extract these measures in all AU languages and distribute them. That will be a huge favor that you're all doing in promoting good public health practice during these unprecedented times. Thank you.
Thank you very much. That was Dr. John Nkengasong, the Director of the Africa CDC, taking us through the situation of COVID-19 on the continent and also taking questions on various issues, including the new variants of the virus that have been found in some parts of our continent, but also in the UK and in Europe. And a safe, festive season. From all of us here at the African Union and at the Africa CDC, safe and happy festive season. But we will be back with you next week at the same time. That is 11 a.m. time in East Africa. Thank you and bye-bye.
Bye-bye.